Hello friends, how are you? This is Dr. SriNagi, Ayurveda and medicine doctor and also Isha Hatha yoga teacher. So today in this video we are going to talk about the remedies that are mentioned in Ayurveda for joint pain. As you know, we all know why joint pain happen, what is the history of joint pain. Regarding joint pain, I have already created a lot of videos like what kind of joint pain you have. It is rheumatoid arthritis, which is known as Amvat, or it is osteoarthritis, that is known as Sandhivat in Ayurveda. So here I am going to talk about the Sandhivat, that is generalized joint pain. It is not connected with autoimmune disease, that is known as rheumatoid arthritis. It is just a joint pain because of osteoarthritis, or it's just joint has pain. You don't have rheumatoid arthritis, mild osteoarthritis maybe you have, but still the joint is paining, maybe out of aging or any reason, but it should not be rheumatoid arthritis. So today I am going to talk only about the joint pain that is known as Sandhivat, or it's more near to, if you want to understand what kind of joint pain, osteoarthritis, not rheumatoid one. So the first treatment that has been mentioned in Ayurveda for as a remedy for joint pain is balancing the Vata dosha. In Ayurveda, this joint pain or Sandhi Vata, as you understand the name, Sandhi means joint, Vata means pain. So that means this pain is happening because of Vata dosha. Whenever we have Sandhi Vata or joint pain, we will do the Vata balancing treatment. So first thing in this is diet. What kind of diet you should take? If you have pain in any kind of joint, you should take start taking Vata balancing diet. Even if you have Vata body type, Pitta body type, Kapha body type, any body type if you have, but if you have joint pain that is kind of Sandhi Vata, not rheumatoid arthritis, because the treatments that I am going to tell in this Sandhi Vata, that is nearby osteoarthritis, Sandhi Vata is nearby, the symptoms are very similar to osteoarthritis, not rheumatoid arthritis. The treatment, the mode of treatment is different. So again and again I am saying it's very important that first you diagnose that whether your joint pain is Sandhi Vata or Amvata, means rheumatoid arthritis or osteoarthritis. It is also very important because joint pain can be because of these two reasons. So if it is Sandhi Vata, that is osteoarthritis, so on that line of treatment we will go. So if it is Sandhi Vata, it is because of excess Vata dosha. In this disease, Vata dosha is involved or aggravated, or this Vata dosha is causing this kind of pain. So we will do Vata balancing treatment. So the first thing is Vata balancing diet. Regarding Vata balancing diet, in my channel I have created many videos how to balance your Vata dosha, like don't eat tin canned packed food, have freshly cooked meals and take warm meals, try to have organic food, try to avoid all the cold drinks, soft drinks, all kind of things. Try to avoid very raw diet. Fruits you can eat, but if you are eating something raw vegetables, or you are on raw diet, then please try to avoid. If you are eating too much sprouts and skipping the cooked meals, this also don't do, because too much sprouts also aggravate the Vata dosha. If you have joint pain, if you are taking curd at night, then also this try to avoid. If you are eating curd, sour curd, then also that you try to avoid. All the Vata aggravating things I have mentioned in the video. So you please watch that video and you can make points like what are Vata balancing diet, not to do overexert, all these kind of things are being mentioned. So first thing is you need to balance this Vata dosha. What is the second remedy which you can use to balance the Vata dosha that is mentioned in Ayurveda is steaming. Decoction, or you just warm the area, like whichever joint you have pain, so you will give steam therapy to that place. So there are various ways that you can give steam therapy or hot bath to that place. That is, you can use certain leaves like nirgundi. Nirgundi is a plant which is very which has anti-inflammatory properties, or there is another thing in Ayurveda that is known as Dashmula. So either one of these two, the botanical name of Nirgundi is written in the screen. So this plant leaves, you can boil the leaves of this plant and then just take the joint, whichever joint it is, whether it's ankle joint, whether it is knee joint, whether it is shoulder joint, whichever joint it is, and then you just let's suppose this is my joint. Let's suppose this is my joint. Like this is how I'm keeping my joint, and put a vessel under this joint. Like you put some vessel under it and take a cup, some cup in which you fill this water decoction, which I am saying Nirgundi. What is decoction? You need to boil, you need to take 10-20 plant leaves, this Nirgundi leaves, and then you boil it for 1 hour. The color of this water will change, it will turn into little greenish, and then you put this joint. Let's suppose this is the joint that is affected, and then you make it little that much temperature that your body can tolerate. It should be warm, but it should not be burning, that if you will put it will burn your skin. It should be tolerable, little higher than the warm, little higher than the warm, but it should not burn the skin, that you will do this procedure and you will get blisters. If you have a child who has joint pain, then over careful, because children's skin is very soft, and if you have a child and you want to do this process, please do it under some Ayurvedic doctor's guidance. But if you are adult, then just the warm temperature, the temperature of tea, coffee, like that, warm one, and then take this in a cup or in a glass or in anything, and then you just pour it slowly in this joint. Like it should be pour water or just exactly on this joint, and there is a tub under it where you are collecting this all the water again. And once this one process happens, like once you did it, then again you can heat this leaves water and again do the same process and again do the same process. It is very beneficial. It will give you instant relief in the pain, the pain that you are getting. So this is decoction bath, you can say, or you can, if you have a steamer, like this kind of instrument, if you have, where you can make the steam of this decoction, and there is a pipe, with pipe also you can from which steam is traveling. So with that pipe also you can heat this area, just the steam should pour on this joint, but the steam temperature is very high, that is 100 degrees. So make sure the steam, when you are putting, you don't put it continuously, you just put and remove, so that this joint will not get any kind of blisters. Whether it is your this knee joint, shoulder joint, any joint, whichever has pain, this can be done. So after that, next thing, third process which you can do, that is massage the joint with some oil. So which oil is the best oil? Mahanarayan Tailam. So there is I have written the word Mahanarayan Tailam. If you will get this kind of tail, means oil, from some Ayurveda pharmacy, or good quality oil. So with this oil you can do massage to that joint, from the top, from the bottom, everywhere, like you do the massage. So this was the third step. Next thing is, before doing this massage, you can also do this much, like heat the oil little bit. If it is in plastic bottle, shift it in some brass pot or even steel pot or anywhere, and just heat it little bit. It should not be overheated, because oil temperature is very hot. It can also burn your skin. So it should be little lower than your tea temperature, so that it will give a soothing feeling, not blisters on your joint. So there usually this osteoarthritis which I am talking about, Sandhivati, does not happen to this joint, but I am just taking example as this joint. Mostly it happens to knees or to shoulder joints most often, or the ankle joint. So it is just as an example I am telling you. Sometimes this sacral joint also, where your spine and this hip joint which we say, so there also it happens. So this warm medicated oil, you just do massage, whole joint you do the massage. So this massage happen. After doing the massage, don't expose itself, this massage place, to the air. So better this process you do at night before sleep, so that after doing this process you do not go outside in the air, in cold air or in these places. Otherwise the pain will get aggravated. After that you can cover it with some cloth. Don't tight it, but just gently cover it and sleep. So this thing you can do. This is a very good treatment for Sandhivata or joint pain. It gives you instant relief, and you need to do it 21 days. Definitely you will get some relief if you do all these processes. After that is, what is dietary recommendation in this? Dietary recommendation is that your colon should be properly clean, your intestine should be properly clean. So what is the best way to clean your intestine? That eat fruits, not raw but fruits, and have light food, more soup diet, more liquid diet you take, because when you have Sandhivata problem, joint pains problem, then many times it has been seen like you also have a problem of gas in the stomach. So make sure the kind of food that you are eating, you are putting in your stomach, that should be of Vata balancing nature, so that it will not create constipation or these kind of problems to you in the stomach. Because in Ayurveda, whatever healing we are doing, whether it's joint, whether it's anything, we focus on our Jatragni, that is your digestive fire. That digestive fire should be good to heal any kind of disease in your body. In addition to that, you can take vegetable soups, that is very beneficial. Hot vegetable soups, not market one, homemade. So these vegetable soups you can take, and you can also use ghee little bit, and ghee and milk, those who are taking milk and ghee combination also you can use. This also helps in balancing the joint pain. So these are the various processes that are mentioned in Ayurveda that are being used to treat the joint pain. You can try these processes and see, definitely there will be certain benefits. So that's all for today's video. Thank you so much for watching, and if you're watching me for the first time, there is a bell icon, there is a subscription button. Please click the bell icon, hit the subscription button, so that you stay in tune with our upcoming videos. Also, if you would like to support us, there is a join button near subscription button. You can click this join button and you can support us. Those of you who want Ayurveda consultations, please write to me on this given email ID, and I will let you know how we can schedule it. If you have any questions, please write down those questions in the comment section. I will try to answer questions in the best possible way. So with this note, I would like to say, stay healthy, stay blessed, take care. Bye.